Right, so let's have a think about the use of PBM specifically for osteoarthritis. I think a real key thing that I'd like you to think about, I know this is a photobiomodulation course and we are obviously going to consider the specifics of that, but I'd like you to really think outside the box with this one, because I think OA is a special case, if you like, because it's not just about the joint, it's about so much more than that. So we're going to have a look at the big picture, and I just want you to consider how you can use PBM as part of your perhaps your overall treatment plan. So first of all, we need to think about whether we can get to the joints or not. Now, we've thought about depth of penetration for laser. We know that the skin is a bit of a hindrance for us there. And, you know, we need to really think about some of these big joints, especially with horses. Are we going to be able to get there? We'll talk about application in a moment for some little tricks and tips about how we can improve the depth of penetration with our application techniques. But really, we do need to think honestly about whether we're going to get into deep joints like the sacroiliac on a horse with photobiomodulation. And I don't really think that we are. Now, when you look at a joint like this, which is a hock, and it's swollen, you can see you've got a fusion there. That's not a very clear picture, but there is a fusion there of that hock joint. The joint itself, or the joint capsule, in certain places is actually really quite close to the surface. It's not that deep down, so you're not going to go through any of the bones to get to the joint on the other side. You're not going to necessarily go through huge areas of muscle, depth of muscle to get to down deep to a joint. But when the joint is relatively close to the surface, or in particular areas where it's close to the surface, then you should be able to get there if you use clever application techniques. So we just need to think about, it's not just the joints that we're considering. We need to think about the overall picture of OA and how it affects the animal as a whole. So we can go in and we can just target the joint, and we can get some pain relief from that, modulation of inflammation, and all that is great. But we need to consider more the animal as a whole. And I think where phototherapy becomes very useful, photobiomodulation becomes very useful, is when you use it as part of an overall treatment. So with any case, the way I tend to look at any case really with rehabilitation is initially we need to go in there and dampen down the pain. We need to help with the primary problem so that we can get the animal more comfortable, and then we need to re-educate them to move better. So where PBM I think fits in really nicely to this is we can come in and we can use it for the osteoarthritic joint and the surrounding area to reduce the pain, and to get some biological processes going and moving again. But then what the overall effect that we're going to get of that is the animal is in less pain and they're going to move better. And as soon as they start moving better, the joint will start to improve. You know, if a joint, especially when we don't have any of those shear forces on a joint, if we have nice stable movement on a joint, that will help it to even cause some repair from osteoarthritis, some damage to the cartilage, etc. That's another talk altogether. But actually, what we do want to do is we want to get these animals moving. Now, even though we want to get them moving, there is a whole rehab part of that we need to get them moving correctly. Otherwise, you know, shear forces on the joint are not a good thing. So it will need to be followed up with rehab. But I think to use photobiomodulation to reduce that pain, not just over the joint, but the global picture. So when you see, let's take an osteoarthritic dog, for example. Maybe they've got hip osteoarthritis, but they generally tend to have shifted all their weight forward. They've got a really sore neck. They've got lack of range of movement in their elbows, in their neck, in their spine, their posture, their core strength has gone, and all of those things need to be addressed. So all I'm trying to say really is we can't just go in there and say, okay, we're going to do PBM for the joint. I mean, we can, and it will help to a certain degree, but if you take it as part of the overall picture, you're going to get much more success. So let's just have a think about application. The key thing is that we need to try to get into the joint, and we do know that the skin is a significant barrier, and there's a couple of studies that we'll consider a part of one of the other lessons that show us that in fact when the skin is removed, the penetration is much increased. We can't obviously go in and peel off the skin, treat the joint and put the skin back across. I don't suggest that as being a good technique. But what we do want to do is try to get into the joint as much as we can. So we need to think about the way we angle the phototherapy, where we actually, photobiomodulation, I keep saying that because it's an old term, where we actually get into the joint and where we can target the photobiomodulation to best get into the joint. Okay, so we really need to think about that. When you look at a joint, this is where you need to absolutely know your anatomy. You need to know where the pockets and the areas are, where the joint capsule gets nearer to the surface, and you really need to consider your anatomy and where you can attack the joint from which angle. And then we just want to think about contact. Now again, in the same study that I've just referenced, and I will put in for you guys to read in your reading and digestion time if you would like to read that, there is also it does also show that that contact, that having the photobiomodulation head in contact really increases the depth of penetration, or really increases, it also will go on to increase the efficacy of the treatment. So we need to, where we can, get that treatment head in contact with the skin, and even apply some pressure to that so that we can get deeper down, which we've covered in a different lesson and looked at that. But the issue is, if you have a painful joint, then contact, or quite a firm contact with that head, can cause pain going back and forward over that joint. And that will be with a class 4 laser, you'd need to move back and forward over the joint. With a class 3B, you wouldn't need to, and you could move around. So with those cases, you know, you don't have to press so hard. But whether you get that depth of penetration is the question that we're still not entirely sure on. But we do need to think about the technique that we use and whether that contact is going to cause any pain. If it is, then we need to not use that amount of pressure, and that will affect our dose. So that's just something that we need to consider. Also, when we're looking at osteoarthritis specifically, we're over bony areas sometimes. There's also another research paper which you'll cover as part of this lesson, where they treated osteoarthritic elbows, and they had to they couldn't obviously go deep in with the contact and the pressure because it's so bony around there, and it'd be really uncomfortable. So that's just something that we do need to consider. Some therapists will suggest joint traction. So this is where you, in basic terms, pull the joint apart so that you can get deeper into the joint line. I've not had much success with this myself. You can do it, you can give it a try, just gently sort of traction that joint so that you can angle the head more into the joint line and directly into the joint. I do find though, if you've got an osteoarthritic joint, that joint traction can be quite uncomfortable. So that's not necessarily something that I don't think is necessarily that effective. Although if you've worked on them for a bit and you can get that joint to sort of a little bit more traction on that joint, then that might be successful in some cases. And then the other important thing is that we need to take a 360-degree approach. So rather than just come into the joint from one side, like here we've got this little chap laid on his back, and we can get into the ventromedial hip area as shown here on the with the red mark. So you would do half of the dose on one side and half of the dose on the other side, or even some caudal to that. So basically just the best way to target the joint, but to also use that 360-degree approach rather than just going in on one side and keeping it all on one side will be much more effective. Again, we want to work with depth, so if we can catch a joint from one side and catch a joint from the other side, that's going to be better than just doing that on the one side and hoping that it's going to go all the way through. Also, the skin, the hair is normally less. There's normally less hair on the inside, the underside of their belly as well. So that can be a good way to override the hair problem. And then just finally, I just wanted to mention that posture breaks are sometimes essential if they are stood for a long time or having to lay or move so that you can get into a particular joint, or if you are using traction or any particular positions that might not be the most comfortable for the animal, then you might have to stop and give them some breaks. So that's just something else to consider. Okay, so that's just a different angle to look at osteoarthritis and PBM treatment. I hope you can see that really an overall approach would be better.